Hi everyone, I'm Bridget Whitney, founding CEO here at Kids Food Basket. For over 18 years, we've been nourishing children to be their best, both in school and in life. Now, at the height of COVID-19, we've seen a magnification of disparities in our West Michigan community among children and families that don't have access to good, healthy, nourishing food. Today, we're having a conversation that we're calling Nourishing Narratives, where we've gathered experts to talk about the importance of good, healthy, nourishing food and the importance of barrier-free access for all of our children here in West Michigan. I think it's really important to talk about some of the images that we've seen over the past 5.5 months during COVID-19 around families who are struggling to get access to good, healthy food. What have you seen in terms of our food systems, food access, and what has been your experience over the past 5.5 months specifically?
There's so many multifactorial issues, whether I'm the frontline worker who has to go to work to provide for my family, or I'm the poultry worker who gets, COVID and has to be off work, whether I'm out of a job and I have to access, and that really hit people very hard. And I think what you saw was people that would say, I will never have to go on public assistance or reach out for food. They were accessing that. And we saw how fragile we are and how dependent we are to all the layers in our food supply chain.
Great point. How fragile it is and how quickly it breaks.
My experience or my work is with people in poverty, and poverty is social isolation. And COVID, people were shut in. So the access was even greater of an issue. And the depression related to that. The messages were all stay home, stay home. And the conversation through telehealth, televideo, et cetera, was, I need resources, I have to get out, and these resources aren't coming to me, so I have to go there.
I would add that I've had the opportunity to sit with a number of community organizations. So at Metro Health, especially with COVID, we were very intentional that we wanted to go out and hear from the community and to understand the needs of the community. And it was very eye-opening for me to hear food be named at many different tables as an issue for families. Either it was access to it, meaning there were transportation issues and or the cost of it. It's been great to see some of the different organizations throughout West Michigan that may not readily think of food as part of the purview of what they should be focused on, but in linking arms with other community organizations, finding out that we have a role to play in this also.
Truly, absolutely, and not all food is created equal, right? And making sure that it's healthy food and how important that is now more than ever. But if you have $5 and you can feed your family on $5 through a drive-through, is much easier than trying to figure out how to stretch that into healthy fresh fruits and vegetables. So, what are your experiences with the disparities in our food system around access to food that is less healthy, access to food that is healthier but more expensive, and how do your families that you work with experience that?
We were home more, so you also had parents home more, kids home more. So where am I going to get my food? And people were so fragile to the point where I used to have that $20 and could maybe get 3 meals out of it, or because it could stretch across several days. Now I have that $20 and I have to make it last for 9 or 12 meals. And so I think that has been more of the experience.
Currently, most of our kids, less than 25% of our kids, eat 5 or more servings of vegetable in a week. So that's the foundation. So then you shut it down. And what was open? Fast food. Wendy's opened immediately, McDonald's opened immediately. Where could you go? So that foundation was rough to start, and this just sent it over the top.
For some of our patients, we have some specific questions that we ask. 40% of our health and well-being is impacted by socioeconomic factors, where you live, the support structures within your family, your access to healthy foods, your education, the income level. Then we also are able to provide some resources that we make available through the hospital, but also to connect our patients and their families to community resources.
Yeah, you make a really great point, is that is how we can best address disparities, and that is how we can best address barriers, is when we're looking at data and understanding where the needs are the greatest and what the barriers are, where the needs are, and then apply programming to be able to address it. I'm curious if you could snap your fingers and make something, for all three of you, make something happen today, right? A massive change today that would really affect nutrition, would affect some of these health disparities, what would it be?
If I could snap my fingers, everyone throughout the United States and the world would agree that healthy foods also taste good.
Yes.
Oh, there
Yes.
you go.
I'm snapping my fingers.
I love it. Put it out there. Put it out there. I love that. I love that.
If I could snap my fingers, and I can't snap them like that, that was a good one. I would say that people know how to grow something. The act of growing the food, whether it's herbs or carrots or something, anyone can grow something no matter where you live. And it's the act of growing the food that has the mental health benefits in addition to the nutrition. It tastes better if you grow it yourself.
That's
just saying.
There's a couple things that if I could snap my finger instantly, and maybe it's the healthcare provider in me, I went to easy healthcare access for all. Knowing that what we do when they get to my office is, really impacts only 20%, but when we make that so difficult, the other thing is, I'm going to snap my fingers twice, yes. is that we allow opportunities to bring nutrition into the clinical space. Because honestly, in my 15, 20 minutes, we have to see patients. I'm like, are you wearing your seatbelt? Are you wearing your helmet? Let me get your vaccinations. Oh, and by the way, you're obese, eat healthy. And for everybody, that's so different.
Dr. Lowery, you need to come work for me because we have that program. And we call it Prescription for Health.
Yep.
And so they come to see the doctor and they have poor health, so they write a prescription. They take it to the community garden, which is right next to our clinic. A community health worker is with them. Then they enroll in 6 weeks of classes with other people in that social isolation. When they say their favorite part is not only do they learn how to cook this and that, but there are people they met who live in the same neighborhood who they didn't know before. So after they leave, that's that social determinant of health.
That's great. Also a massive reduction in barriers.
Yes.
By having all of the services in
Right
one
there.
spot and accessible to people. That's so important. I feel like a theme that came out of all of us snapping our fingers, a theme is around that healthy habit too. Around people loving the healthy food, growing healthy food, and understanding where it comes from. And that's one of the things that we're really focused on at Kids Food Basket, is teaching kids where healthy food comes from, why that's important, how to make these lifelong healthy food choices. What has been, in your experience, that has been a catalyst?
We always thought it was going through the parents, so we made that mistake for years. And then once you energize that kid, they then influence the parents and the families and the extended. So we go right to the kid.
I think meeting the family where they're at and really having that conversation, having that opportunity to say, what's a typical dinner for you? What's a typical day for you? Okay, well, you can do that, but how have you thought about this? And just showing people different ways to enjoy something.
I would say making sure the way we're also presenting these food options are culturally relevant. And so definitely it's not a one size fits all. And what's appealing in appearance and taste and flavor for one community can be the exact opposite for another. And there's the greater potential for families and communities to receive that information and respond to it when it's more culturally relevant. Since the 80s, the price of manufactured food has gone down by 40%. The price of good, healthy, nourishing food that grows from the ground has gone up by 40%.
So what does that mean? It means families who are struggling with the barriers of poverty have less access to good, healthy, nourishing food. And unfortunately now that has become generational as well. And I'm curious what your thoughts are on, as a whole, the disparities that exist around healthy eating and healthy eating access, around what's available for families.
There was a lot of research that talked out there about how healthy foods are not costly, and it's a myth. And so, and as I was reflecting on it, I was thinking, okay, so why is my understanding that it costs more to eat healthy? And if it is indeed a myth, and yet I have that understanding, how many other people in communities have this understanding? So how do we dispel that notion that it does not have to be more costly to eat healthy, and provide families with that information? So even if it's giving families easy recipes that include grocery lists of what to buy, you know, as one example, but somehow steadily dispelling that notion.
For me, I always couple it with physical activity as a, you know, more of a larger lifestyle. People start to feel better. They can now walk to the mailbox. When they come back, there's less inflammation, there's less lethargy. So eating healthier then becomes more, I think I'll have an apple because I'm feeling good right now. So we see that dynamic, that those have to go hand in hand, and you don't need any money to do exercise, zero. You can do yoga, stretching, walking.
And I think educating, how do I make it easy? And it might not start with, I'm gonna need you to go get fruits and veggies fresh. Maybe it starts with, I need you to get fruits and veggies frozen. And I'm gonna teach you, or in the can, and I'm gonna show you how to do that. And so how do you kind of be able to prepare a meal in 20 minutes that is a healthy meal, and then we can go out and walk or something like that?
What is the importance for kids to have healthy food on physical development, social emotional development, educational opportunities in school? Where does healthy food intersect with that development for kids?
It's one of our basic needs. Even when I'm counseling our families, I usually say 3 of our easiest drugs out there: healthy diet, or healthy eating, not diet, exercise, water, and sleep. So that's 4 things. You know, if you do those things well, you'll be healthy.
I think it couples really well with some of the initiatives that I've seen across the nation, but certainly in West Michigan, which is teaching kids meditation or stress reduction techniques. And that's really helpful with eating.
Yes.
We talked about rushing through. When you rush through, you overeat because you eat past when you're full. When you teach some of those other techniques, which is about stress reduction, they get to enjoy food differently. So it's a different relationship with food altogether.
I'm hoping that children and youth will even think about it as, this is a resource that's going to help me perform better, it's going to help me think better, it literally fuels my brain, it's going to lessen the likelihood of having chronic diseases as an adult. So then I don't just live life, but I live a high quality of life.
They're here.
Yes,
They're here.
I love that. When you have your health, you have so much, right? When you have your health. In our first few years of Kids Food Basket, the very first time we did a data dive and talked to the teachers and did surveys with all of the teachers we were serving, that was one piece that came back consistently. The teachers were saying, because we serve 5 days a week, and we're showing up 5 days a week, we're actually making more of an impact because kids are getting those healthy fresh fruits and vegetables daily. But also the importance of educating around it too. Why are we eating carrots, right? Why are carrots good for your eyes? And okay, I get the carrots and I know why the carrots are good for me. And that intersectionality of education and access can really move a needle significantly. Do we feel like 10 years from now, we will be a healthier West Michigan?
Absolutely. Absolutely. We're going to get Dr. Booker out there getting us all revved
That's
up.
right.
I'm like,
Yes,
I'm
we
ready.
are.
Yes, we
Yes,
are.
we
Yes,
are.
absolutely.
Unfortunately, COVID has shown light on things that we've been dealing with for decades. But I hope now we can actually move the needle. Because what so happens so much is we have to have so much data and tell you why this is so important. I guess I'm a little more cautiously optimistic. I hope we're better, but I hope we can put things in place that are sustainable.
Yeah, I agree that we certainly can be a more healthier community, but if and only if we are willing to stop blaming people and to go deeper into addressing some of the systemic barriers. So we've talked about barriers related to transportation, educational systems, housing systems, economic systems, political systems, et cetera, working across all of these systems to make this happen. So I say this often in my work in diversity, equity, and inclusion, that no one and no organization gets to sit on the sidelines. And it's the same case as it relates to specifically to food and nutrition.
And working collaboratively.
And working collaboratively.
Because otherwise, oh, it's just your problem.
Yes.
Or it's this their problem.
Yes.
You know, we don't have that problem. Oh, that's just Twin Lakes. We don't have that problem. That's so much what we kind of, like you said, blaming the people.
Food centers around everything. It's the root of our health, right? It's the root of community. It's what brings us all together. And when people have access to good, healthy food and they have their health, they have opportunity to reach their full potential, which is just more important. It's the most important, truly the most important. Ladies, I'm so grateful for all of you and your time today and your expertise in sharing this, and also your love for children and families and healthy nutrition.